Some South Carolina public workers say they can't afford or access their medications under the state agency designed to make things easier.
Meanwhile, frustrations are being felt from behind the counter as independent pharmacies struggle to cover the soaring cost of prescription drugs.
Our Caitlin Ashbaugh joins us live in Greenville. Caitlin, seems to be a layer of issues here for health workers and for the patients they serve as well. What can you tell us about these issues?
Absolutely, Sydney, Jane. Well, what we're seeing here is that these patients that we spoke to, they're people who have life-altering conditions, things like congestive heart failure or Crohn's disease, and they're living without treatment. And that price tag not only weighs heavily on them, but also these mom-and-pop drugstores who are struggling to stay afloat.
Stone Plaza Pharmacy, can I help you?
Between 75 and 100 customers make their way into Stone Plaza Pharmacy every day. 5 years in the business, Tom Conrad's profit margins are growing slim, making less than the double digits back, and in some cases, net losses. For high prescription drug payments made in the thousands.
The brand name medications hurt people all the way around, except the insurance companies and except the pharmaceutical companies. It's as plain and simple as that.
The growing pains extend beyond just the counter as medication prices surge year to year. In January, SCPBA announced they would be switching pharmacy benefits managers from Express Scripts to CVS Caremark to fight rising market prices for 700,000 state workers and retirees. Since the transfer, State Representative April Cromer has reported more than 30 concerns of denied, delayed, or unaffordable prescriptions.
I don't think this is something that we should take lightly because it is people, their health, their livelihood, keeping them alive.
Discount sites aim to relieve the prices for patients through downloadable coupons and savings. In the case of Trump RX, the list of available medications are still limited to what's popular or expensive on the market. Independent pharmacies take expensive stock, controlled substances off the shelves in attempts to cut costs and recover.
Private pharmacies, they're losing money, and we're going to lose a lot of our small pharmacies by the end of the year.
Some months feel great, and some months just you're wondering why you're here. You're helping the community, but the difficult part is you're here more than 40 hours just trying to figure out how to stay afloat. All right, thank you.
And SCPBA did respond to our request for comment regarding those state worker claims. They told us that whenever they went through the vendor process, this deal with CVS Caremark was, quote, the most favorable option for them. They also said and claimed that there were no changes to co-payments in 2026 that they were aware of, but they did say that co-payments are linked to the selected PBM's list of covered drugs, and that might alter those just slightly there. We did reach out to CVS Caremark as well. They did not provide a separate response to us. Reporting in Greenville, Caitlin Ashbaugh, WYFF News 4.